personality is the unique set of emotional, cognitive, and behavioral patterns that define how we interact with the world. While cancer is primarily caused by genetic, environmental, and lifestyle factors, recent psychological studies suggest that certain personality traits and emotional patterns may have a role in cancer risk, progression, and recovery. For instance, traits like chronic stress, suppressed emotions, hostility, or lack of social support might weaken the immune system or increase inflammation, conditions linked with cancer development. On the other hand, traits like optimism, emotional resilience, and a strong support system can enhance quality of life and may even improve treatment outcomes. Though personality alone cannot cause cancer, it may influence how the body reacts to stress, illness, and treatment. Understanding this mind-body connection can open new doors in cancer care by addressing not just the disease, but the person as a whole.
Hey there! Today, I want to break down something that affects millions, but still feels confusing and scary: cancer. What actually is cancer? Imagine your body is made up of billions of tiny building blocks called cells. Normally, these cells grow, divide, and know when it's time to stop. But sometimes a cell's DNA, its instruction manual, gets damaged. When this happens, the cell can lose control, start growing out of bounds, and ignore the signals to stop. This wild growth creates a lump or mass we call a tumor. But here's a twist. Not all cancers form tumors. Blood cancers like leukemia spread throughout the body without forming lumps. Now let's talk about the main types of cancer, based on where they start. First up is carcinoma. This is the most common type, starting in the skin or the lining of organs. Think breast, lung, prostate, or colon cancer. Next, there's sarcoma. These begin in the body's connective tissues, so bone, muscle, fat, or blood vessels. Osteosarcoma in bone, liposarcoma in fat. These are examples. Leukemia is different. It's cancer of the blood or bone marrow, where there's an overload of bad white blood cells crowding out the good ones. You might have heard of ALL or CML. That's acute lymphocytic or chronic myeloid leukemia. Lymphoma and myeloma attack the immune system. Lymphoma starts in the lymph nodes. Think Hodgkin or non-Hodgkin lymphoma. Myeloma targets plasma cells in your bone marrow, like multiple myeloma. And finally, cancers of the central nervous system. These start in the brain or spinal cord. Glioblastoma is one example, and it's as tough as it sounds. So what cancers are most common? For men, it's prostate, lung, colon, liver, and bladder cancer. For women, breast, cervical, ovarian, uterine, lung, and thyroid cancer top the list. Some cancers are specific to each gender, like prostate or testicular cancer for men, and breast, cervical, or ovarian cancer for women. What causes cancer? Lots of things can play a role. Genetic mutations, smoking, drinking, a poor diet, being overweight, infections like HPV or hepatitis, exposure to radiation or pollution, and even family history. But here's the good news. There's a lot you can do to lower your risk. Eat healthy, move your body, avoid tobacco, and limit alcohol. Get regular screenings like pap smears, mammograms, or PSA tests. Vaccines can help too, like the HPV or hepatitis B vaccine. And remember, early diagnosis really does save lives. Cancer can be overwhelming, but knowing the facts helps you take action. Stay informed, take care of yourself, and never hesitate to talk to a healthcare professional if you have questions or concerns.
Does your personality affect your risk of getting cancer? Let's break down the science, the psychology, and the facts behind this fascinating question. Cancer and personality, a detailed overview. 1. What is personality? Personality is basically the unique mix of traits, thoughts, behaviors, and emotional patterns that make you, well, you. It shapes how you react to stress, how you deal with illness, and how you handle life's curveballs. 2. Can personality cause cancer? Here's the truth. There's no direct scientific evidence that personality causes cancer, but certain personality traits and stress-related behaviors might indirectly affect your health, and maybe, just maybe, influence your cancer risk. How? Well, personality can affect your immune system, influence your health habits like smoking or diet, and even change how quickly you respond to early symptoms. But let's be clear, personality does not cause cancer. At best, it plays a small, indirect role. 3. Psychological theories linking personality and cancer. So, where did the idea come from? Some psychologists have floated the idea of a Type C personality, sometimes called the cancer-prone personality. Type C personality, cancer-prone personality. Type C folks supposedly suppress their emotions, especially anger, avoid conflict, and seem calm but may feel helpless inside. The theory is that bottling up your feelings can mess with your immune system and maybe make you more vulnerable to disease, like cancer. But here's the catch. Scientific support for this is pretty weak. Most studies are inconclusive or have flaws. Stress and immunity. Now, chronic stress, common in certain personality types, can suppress your immune system and lower your body's ability to fight off cancer cells. That's a legit concern. 4. How personality affects cancer coping and recovery. Personality really shows its power after a cancer diagnosis. Optimistic, resilient personality. If you're optimistic and resilient, you're more likely to stick with treatment, rally social support, and generally have a better quality of life. Anxious or pessimistic personality. If you tend toward anxiety or pessimism, you might struggle more, avoid treatment, or feel overwhelmed. Hardiness and locus of control. And if you believe you can influence your own health, that's called an internal locus of control. You're likely to take better care of yourself and handle cancer-related stress more effectively. 5. Psychological interventions based on personality. Knowing a patient's personality can actually help doctors and therapists suggest the best support, like cognitive behavioral therapy for anxiety, support groups for those who feel isolated, and mindfulness for those who tend to suppress emotions. There's even a field called psycho-oncology that focuses on the mental health of cancer patients. 6. Summary. Let's sum it up. Direct link. No proven causal link between personality and cancer. Indirect link? Maybe through stress, immunity, and health habits. Coping influence? Huge. Personality really affects how people respond to cancer. Therapeutic use? Yes. Tailoring mental health support to personality makes a real difference. Final thought. So, while your personality probably won't cause cancer, it can absolutely shape your experience if you ever face it. Knowing yourself and getting the right support can make all the difference in your journey and recovery. Take care of your mind as much as your body.
And if you found this video interesting, don't forget to like, subscribe, and hit the notification bell for more mind-blowing psychology videos.